Hello, my name is Dr. Tarush Rustagi, and today I will be speaking about osteoporosis. Osteoporosis is the term that we often hear in newspapers and in magazines. Osteoporosis is basically the aging of the bones. It is important to understand why does osteoporosis happen. It is based on the concept that when we are young, the bones of our body take in a lot of calcium. Till the age of 15 to 20 years, the bones take a lot of calcium and get strong. However, after the age of 25 to 30 years, this intake of calcium stops, and then this is followed by a gradual removal of the calcium from the bones into our body. Especially in females after the age of 50 or after they have achieved menopause, osteoporosis is prevalent. There are numerous other causes of osteoporosis, such as associated with certain diseases, use of steroids, certain medical conditions that can cause osteoporosis. It is important to know these facts because a regular intake of calcium and vitamin D, especially in females after the age of 50, is very important to prevent excessive removal of calcium from the bones that can be catastrophic. Why it is important is because patients who have osteoporosis have a higher than normal tendency of developing or sustaining fractures in their spine, in their hip, and in their wrist. Osteoporosis is also associated with weakness of the muscles, which is commonly termed as sarcopenia. The diagnosis of osteoporosis can be established by number of means. There are certain indirect methods by which osteoporosis can be established, such as X-ray. A past history of fracture are some of the findings that are commonly seen in osteoporotic patients. Certain investigations, such as a DEXA scan, can be done to establish the limit or the amount of osteoporosis present in a patient. Once the diagnosis has been established, it is important to start on certain specific medication to prevent osteoporosis, which can be in the form of oral medications in most of the patients, and at times when the osteoporosis is severe, it can be in the form of certain injections. When osteoporosis of the spine is associated with the fracture of especially of the low back, it can be a very debilitating problem. Most of the times these fractures are benign and are not worrisome, and they have a strong and they have a high tendency of healing with some rest, with some modification of activity, and in certain cases using some sort of a brace to help healing. In certain situations where the fracture is very painful, in certain situation where the fracture does not heal with time, certain minimally invasive procedure including cement injections can be done within the vertebral bone to stabilize it and to help in pain alleviation. However, it is important to also aggressively treat the osteoporosis with medical management to prevent any further fractures of the bones. Last but not the least, it is important to know that osteoporosis is inevitable, especially in females, and I would request all the females and all the males also to have a healthy lifestyle, to take adequate amount of calcium and vitamin D in their diet. If they are having low back pain, especially associated with a very trivial or a small intensity fall at home, to get themselves checked by a doctor, because it can be associated with a very small fracture which can develop into a big problem later on, and to get yourself regularly checked regarding the same. Thank you.